Thank you for joining NCBA and Amgen as we present a webinar on asthma disparities in Black and African Americans. One of our presenters today is Arinze Onwalu. Thank you, Arinze. And Arinze graduated Temple University in May of 2022 with a doctor in pharmacy. While in university, Arinze's academic focus was on clinical research, covering topics like clinical trial management and good clinical practice. His involvement in groups such as the Industry Pharmacists Association provided him with a comprehensive understanding of the pharmaceutical industry's operations and ability to assist patients. After graduation, Arinze was accepted into the two-year Howard University College of Pharmacy Pharmaceutical Fellowship Program, where he began work with Amgen in 2022. There, he took part in multiple projects, including the development of medical content, engagement in scientific inquiry to address unmet needs in communities. He participated as a member of the Representation in Clinical Research, otherwise known as RISE, and he communicated patient education services via the Learn to Understand and Manage Severe Asthma, the LUMA program. Thank you. Welcome to having you. Good having you, Arinze.
Wonderful.
Also, our other presenter is Matthew Stryker, who's not new to us. Thank you again, Matthew. Matthew received his pharmacy degree from St. John Fisher College in Rochester, New York. And as he says, go Bills. He joined Amgen in 2019 and supports the asthma allergy team in many ways, which include educating patients with asthma and their caretakers or caregivers to help them better understand the causes of asthma and how they can become a champion for their care. Prior to joining Amgen, Matthew worked as a pharmacist in a large provider office. Among his many responsibilities, he provided education to patients on heart health and diabetes management in underserved communities. Two fun facts about Matthew are: he loves to scuba dive and recently did a nighttime dive on vacation. Also, he likes to play pickleball. Matthew, thank you. Welcome again. The floor belongs to both of you. Thank you.
Thank you so much. And I'll go ahead and screen share and hand the baton off to you, Arinze.
All right. So hello, everyone. I'll kick off the presentation today. Thank you for joining us. Next slide. So this is a reminder that this program is being presented on behalf of Amgen and AstraZeneca, and this is an educational program that should not be taken as specific medical advice or treatment. Next slide. And so some icebreaker questions. How well do you understand your asthma? Give you guys a second to type it into the chat. The next slide. And then how is your asthma severity determined? Just be aware this will come up during the presentation. And type it into the chat when you know the answer. We will be coming back to this question.
Have some A's in the chat for symptom severity. And then for the previous question, it looks like there's some basic knowledge and understanding. Great. I'll go ahead. Next slide.
Next slide. Yep. So next question, the immune system can be the underlying cause of a person's asthma, true or false? Give you guys a second. See some truths. Yeah, I like the answers that are coming in. Then next slide. And then patients with severe asthma are recommended to see an asthma specialist, work with their provider to create a written asthma action plan, track their asthma through an asthma journal, or all of the above. I'll give you guys a second.
Like a couple of D's coming through for all the above. D.
Looks like we have a well-educated cohort here with us today. All right, next slide. And all right, so I'm here today to present the asthma disparities amongst Americans. I just want you to keep on the lookout for the answer to those questions, and we'll revisit them at the end of the presentation. Next slide. Yeah, so the reality of the situation is that Black Americans experience worse asthma outcomes when compared to their white counterparts. When we look into the statistics, asthma is disproportionately diagnosed in Black Americans. They are 2 times as likely to be hospitalized due to the asthma-related complications, are 5 times as likely to visit the emergency room or emergency department due to asthma, and are 3 times as likely to die from asthma, with the highest death rate being amongst our Black women. Oh, and along with ethnicity, we can leave it on the last slide, but along with the ethnicity, age may come with other complications such as symptoms may feel harder to control. It can take longer to recover from exacerbations, and side effects from certain asthma medications may be harder to control. Next slide. So, what are the factors that contribute to the asthma disparities we see? Racial disparities in asthma are the result of complex interactions between various levels of social, structural, biological, and behavioral determinants. This includes factors like economic stability that lead to the disadvantages such as poverty, poor housing, and lack of access to healthcare. Factors like distrust in the community due to historical exploitation of Black bodies in medical experiments such as the Tuskegee study, and factors like response to treatment due to genetic variations related to asthma in Black and Puerto Rican populations. Next slide. So what are the approaches we can take as both individuals and as a society to reduce these asthma disparities? Policy improvements aim to expand health insurance coverage, reform guidelines, reduce wage gaps across racial groups, enhance access to quality housing, and decrease pollution and environmental risk. Research institutions can enhance clinical trials by increasing diverse participation, addressing stigmas, improving data collection, focusing on patient-relevant outcomes, and diversifying the researchers involved with these studies. Improvements in education and communication can enhance interactions and understanding between patients and healthcare professionals and provide education and support programs for asthma care. And finally, strengthening our partnerships can improve collaboration amongst everyone involved in the community asthma care. Next slide. And I will hand it off to my partner, Matthew, to finish it off.
Great. Thank you so much, Arinze, for that informative overview on social determinants of health, where there's a lot of great work that's ongoing, but really lots of continued work ahead of us to address so many different parts of a multifactorial system. So again, my name is Matthew. I am one of the Amgen team members here to educate you on asthma care, along with my counterpart Arinze. And just briefly, my Oscar, thank you. I do want to call out NCBA for their continued partnership, Angela, Angie, as well as the Luma team that really worked behind the scenes to help support these resources that you all are seeing today. So Rima, Sonia, Amgad, thank you for all these, and Victoria too. So really now we're going to dive into really the thick of asthma management, soup to nuts, from what is asthma to all the way through to how can you as a patient or caregiver play an active role and participant in your asthma care. So looking forward to the next 30, 35 minutes or so to go through these slides with you. Definitely continue to welcome any questions throughout, so please don't feel like you have to wait till the end. Feel free to drop your questions in the chat. We'll be monitoring the chat just as these things come up, but there are a few pauses throughout as well to just give you a chance to digest and ask any questions that you may have. So first, we'll talk about asthma as a chronic disease of airway inflammation. So just want to actually take a pause here just so we're all on the same page. So when we say asthma is a chronic disease, we simply mean that asthma is a long-term disease. You can think of this as other diseases as well that are considered chronic or long-term in nature. Diabetes, high blood pressure, COPD. Those are all diseases that, generally speaking, are with you throughout your lifetime once you're diagnosed. And as we think of asthma, it is an inflammatory disorder. So similar to perhaps if you have an infection or if you get a cut, the body mounts an inflammatory response. Well, that's the case with asthma as well. And the inflammation is specifically taking place locally within the airway. So it is a disease of airway inflammation. And we'll talk about some of the different ways we can manage that with some of the medicines that we have for patients. So just so we're all recognizing how common asthma is, and really it's a sense of community, here within the US, upwards of about 25 million individuals have a diagnosis of asthma. Now, if we further hone in onto specific groups of individuals based on the severity of their asthma, upwards of about 2.5 million individuals have severe asthma. And we'll talk about how severe asthma is actually defined on the next slide. And then if we take that group of severe asthma, that 2.5 million individuals, over 1 million individuals actually have severe and uncontrolled asthma, meaning that their asthma is very advanced. In the level of control, there's definitely opportunity for improvement. And we'll talk about different strategies we can inform you on to better improve your control if perhaps you are one of those 1 million+ individuals. So we'll come back to these terms in the next two slides again, severity of asthma, as well as how uncontrolled asthma is defined. So severe asthma, what is it? Well, this actually relates to what medications a patient's actually taking. So by definition, a patient with severe asthma, whether or not they're controlled, is a patient that requires high dose inhaled corticosteroids. So this is a cornerstone of asthma therapy. So these patients require high dose inhaled corticosteroid and a long-acting beta agonist, which you can just think of as an airway opener or controller medication as well, to either achieve control or that remains uncontrolled despite these treatment options for patients. So again, severe asthma is defined based on what medications a patient specifically requires. So what are some of the other medications that might be involved in severe asthma management? And perhaps some of these you've seen and are currently using. And we'll talk more about these later on, but at a high level, these can include rescue medications that are used as kind of quick bursts to help you through an exacerbation or a flare-up that you may be experiencing. And then after that, they're only used as needed. You have your long-acting controller medications, and these are daily medications. Jumping over to about 2 o'clock here, if certain patients have a specific type or flavor of asthma called allergic asthma, some patients may qualify for allergy medications. Then we have targeted therapies, which are the biologic medications. And then finally, oral steroids are an option as well for patients, either short-term or long-term. So again, we've talked about severe asthma being defined based on what medications are required for a patient. But what do we mean when we say a patient has uncontrolled asthma, right? How is uncontrolled actually defined? And definitions are important, right? Because we all want to be speaking the same terminology and medical jargon. But uncontrolled asthma specifically occurs when symptoms persist despite following an asthma action plan and also reducing your exposures to triggers. So lots to unpack here. We'll talk about what an asthma action plan is made up of in a little bit. And similarly, we'll talk about triggers, but at a high level, triggers are the things that really kind of irritate the airway that lead to those symptoms that you may be experiencing during an asthma exacerbation. So what are some things that might clue perhaps yourself, your caregiver, or even a provider in that your asthma, whether it's mild, moderate, or even severe, may be uncontrolled? We think of the rule of twos when we think of uncontrolled asthma. So this is nice as we look for consistency in identifying levels of control. And really, there's kind of 4 broad buckets we can think of when we talk about uncontrolled asthma and pulling through that magic number of 2. So a patient with severe uncontrolled asthma might have one or multiple indicators here suggesting uncontrolled asthma. So this can include using their quick reliever medication known as a SABA or short-acting beta agonist more than twice a week for symptom relief. Similarly, if this same medication or class of medications is filled more than 2 times a year, that can be another indicator of uncontrolled asthma. If we talk about kind of bringing it more back home, if you're awakening at night more than 2 times per month because of your asthma, that could be another indicator. And then finally, we had talked briefly about a specific class of medications, corticosteroids. If these are used, the oral version, that is specifically more than twice per year, that's another indicator of uncontrolled asthma. So really, if you answer yes to any one of these questions, your asthma may not be well controlled. So this is a great opportunity to really optimize your care and plan a visit with your healthcare provider to further discuss and share your results. So we've talked a lot about how common asthma is and some of the ways we look at severity and define level of control. But let's take a look at the lungs as we set the stage for the immune system in a little bit and really talk about what's happening locally within the airways, where again, the asthma is really taking place. So working left to right here, what you can see here is on the far left-hand side is an airway. And this is an airway of an individual without asthma. And you can see that there's no inflammation or constriction. So you've got this nice light blue color here, wide open airway. And this is where I pull through my traffic analogy. So you can think of this airway here, that normal, no inflammation, as off-peak times on the expressway. So perhaps during the middle of the day or late at night, no traffic on the expressway. Those cars or the air can freely travel to and from without really any obstruction or interference. Now, if we jump over to the middle airway, what you can see here is that this represents a patient with asthma. these airways here become overly reactive to those triggers or irritants. So think dog dander, pollen. I know Angela and I were just talking about that in DC. And what can happen within the airway is that the body becomes overreactive to it, and that can lead to inflammation, ultimately making it harder for you to breathe as a patient, and some of the symptoms that you may experience, which might be that shortness of breath as perhaps you're walking. So here the analogy, just pulling back through the traffic one, it's not quite rush hour, but maybe it's like 7 a.m. or 3:30 p.m. And here what's happening is there's more cars, more vehicles on the expressway. Things are still able to move relatively freely like the air, but it's not as clean or as clear as it was in the absence of that inflammation. And then finally, if we look over on the right-hand side, still representing a patient with asthma, but here what we're illustrating is that this represents a patient experiencing an asthma attack. You might hear asthma flare-up or exacerbation as another term. And this is where we have even more inflammation. Those airways become even more tightened, and you can even see mucus production that ultimately altogether really lead to obstruction of that airway. So this is peak rush hour. Cars are still moving, but there's a lot of resistance on the road. So that air or the cars are going to have a little bit more of a hard time getting to and from. So again, bottom line here is that we're illustrating asthma is a chronic disease of airway inflammation and what can happen in the lungs as the inflammation increases. So we've talked about some of the symptoms previously, but what are some of the other symptoms that perhaps you've experienced or you've heard family members experience that relate to asthma? And before I go through these, a couple of things that I want to call out is one, every individual has a unique experience with their symptoms and disease, and these can evolve over time. So asthma is a very, what we call dynamic or changing disease. So the symptoms can come and go. And that in part relates to that inflammation that we talked about. But your symptoms are unique, and they may be different from the person sitting next to you who may also have asthma as well. And then the second thing that I wanted to call out is that these symptoms are not specific to asthma, right? So they're very general, and this goes in part to identifying A, if somebody has asthma, and or B, if somebody's experiencing an exacerbation. So definitely informative, but there's a lot that goes into the diagnosis that we'll talk about momentarily. So the symptoms briefly, coughing, chest tightness, as you can see with the lady in the center tile, shortness of breath with the gentleman who's tripoding, and then probably the hallmark we all often associate with asthma is that wheezing as a result of those narrowed airways within the lungs. So just further expanding on this as it relates to the diagnosis of asthma. So perhaps you recall during your patient journey, as you were meeting with either your primary care provider or maybe a specialist, how you were worked up to identify you had in fact asthma. Lots of different pieces that go into this workup. The first being medical history. So medical history, it's very comprehensive, but some of the key things to call out include family history that might indicate that you have asthma. So perhaps a family member of yours has allergic asthma. That might be an indicator that you have asthma as that's being worked up. Similarly, social history. Are you a smoker? That can serve as an irritant or a trigger for many individuals that have underlying asthma. Also, occupational history, which is perhaps something that we don't think about as readily, but perhaps you are exposed to a lot of cleaning chemicals that are very potent. Those can be irritants or triggers for somebody's asthma, or perhaps exposure in some capacity to different perfumes and one's day-to-day job, those different fragrances can also serve as a trigger. Physical exam, pretty straightforward. So the provider is going to do a physical assessment, look, listen to the lungs, and see how they sound as they're performing that physical exam. One key important point that goes into the workup is lung function testing. And you might hear the term spirometry. And really, this provides an objective assessment of how your lungs are functioning. So this can clue us in and really help us identify if, in fact, you have asthma. Perhaps there's another lung disease that's taking place and we have to redirect our thinking. But lung function testing is very important, both at the baseline in the workup and also going forward in your periodic touch points with your provider thereafter. We had talked about symptoms, so I won't spend much time on this, but just highlighting again that these vary with time and exposure to triggers. And then finally, additional testing, which can include our blood tests to identify perhaps a specific flavor of asthma that you might have. So oftentimes we just say asthma is asthma is asthma, but believe it or not, there's actually different types of asthma. Being a sweet guy, I always pull through an ice cream analogy here. So, think about the different flavors of ice cream. While there's not as many flavors of asthma, if you will, there's still a bunch of different types of asthma. And this becomes important, especially as we think about treatment options for patients with severe uncontrolled asthma. And then finally, a non-invasive test that would really indicate if a patient has underlying airway inflammation is this fractional exhaled nitric oxide. So as shown in the visual here, this lady is breathing into this measuring device, which will measure the level of inflammation taking place within her lungs if present. So we've covered a lot. Before advancing to the next slide on the immune section, I just want to take a pause here to see what questions there might be in the chat before we advance. So I do see that there's a question here in terms of, can I outgrow my asthma? So perhaps, so some children, if they have mild asthma, and when we think about, again, those flavors of asthma, it tends to be allergic asthma. Those individuals, if it's mild, may grow out of their asthma. But for children that have more severe asthma, as well as adults that develop adult onset asthma, it's very unlikely that those individuals would actually grow out of their asthma. So thank you for that question. Is there a cure for asthma through the old school method? So Renze, do you want to address the cure question?
Yeah, I could address that. The old school method, I'm not too sure what we're referring to as that, but as of right now, there is no cure yet for there's no total cure for asthma. The causes of asthma still remain unclear, and its symptoms do change over time. As Matthew mentioned, some children can outgrow their asthma or see their symptoms disappear, but after long-term treatment, it often recurs later in life. So treatments like allergy vaccinations can sometimes nearly cure asthma in those with specific allergies, but it's not totally effective for most people.
Thank you so much, Renze.
Mm-hmm.
And then I did see a question, is there a climate that is best for asthma? The answer is unfortunately no. There's not one suitable climate for all patients with asthma. It'll vary depending on what your triggers are. Generally speaking, at higher elevations, there can be potential for less allergens, but colder air can serve as a trigger for certain individuals, as we'll talk about in a little bit, as can hot, dry climates as weather. So while it would be nice if there was one desirable climate for asthma, unfortunately, there's not. And then the last question I see, and thank you for the question, is are there exams available to determine what triggers an asthma attack? So the answer is yes. So one mechanism of testing that a provider can do to assess what may be contributing to perhaps your symptoms of asthma is allergic testing. And there's different ways that a provider can do allergic tests or allergy testing, excuse me, with either a blood test or what's called skin prick testing, where a provider will essentially inject very, very small doses under close supervision of different triggers that may be contributing. And that could be one way to potentially confirm whether or not that is serving as a trigger. I will say that the qualifier there is just because you might react to something doesn't necessarily mean that it is in fact a trigger. So we want to establish that relationship that if, let's say, your skin kind of has that reaction during the skin testing to a cat, if you're exposed to your cat at home, do you actually have the symptoms? Or is it just something that is what we call like an artifact and identifiable just on lab tests? So we want that clinical correlation is what we would call that. So I appreciate that question. And then the other part, actually, we'll talk about this is unfortunately, sometimes it's just kind of a method in terms of we need to explore what we're exposed to, chart to see if re-exposure leads to the same trigger. So we'll talk about some resources that will help support you to hopefully identify the triggers. And I will say, last comment before I advance, that on average, it can be challenging to identify triggers because on average, about 8 triggers are identifiable, if not more, for a patient with severe asthma. So pinning down specific triggers can be challenging. All right, so we'll go ahead and move on now. So now we'll talk about the role that the immune system plays as it relates to asthma. So I think we're all aware that our immune system serves as kind of like our body's army to fight foreign invaders, such as viruses and bacteria. But what's its role as it relates to asthma? And we'll take a look at that momentarily. But just so we're all on the same page here, as far as the immune system goes, we just talked about its role in terms of fighting different invaders like bacteria, the COVID virus, and other what we call pathogens. And people without asthma usually have an initial response that returns back to baseline after the body has cleared those foreign invaders or triggers. But what happens in patients with asthma is that their immune system either might respond too much to something, perhaps respond to something that it should not be responding to, or have an atypical or an unusual response. So as we think about this, and perhaps like you're kind of reflecting on some of your different triggers, what are the triggers that we've been alluding to over the past couple of slides that might lead to those symptoms that you're experiencing? Some of these are more straightforward and obvious, I think, and some of these might be less obvious for us. So the obvious ones I think many of us would pull out are probably what we call the allergens as the triggers. So pollen, cat dander, dog dander, are bacteria and viruses that can lead to exacerbations and really that inflammation in the airway that we looked at. But also some other things perhaps that are less obvious. So emotional state. So laughing, crying, stress, these can all lead to the twitchiness in the airways that can manifest symptoms. Similarly, exercise. Some patients may not have like quote unquote full-blown asthma, but when they exercise, their airways have become overly reactive and they have to take a quick reliever. So exercise can actually also serve as a trigger. We have briefly talked about climate as well, and especially in kind of the climate, no pun intended, that we're in right now with climate change. This can influence one's level of control depending on where you are. So I think about last year with the wildfires coming down from Canada and being based out of New York State, how all the smoke really just penetrated into the northern US and further south, and the impact that that really had on patients' level of control. So these are a handful of triggers. And again, on average, 8+ triggers for a patient with severe asthma. So let's kind of pull all this together that we had just been talking about as it relates to the airway irritants causing that immune response, leading to the symptoms. So we have our airway that we previously illustrated here. The body gets exposed to those different triggers that we had just talked about. From here, we get different types of immune cells activated, so multiple different types of immune cells that have different functions and lead to different pathways and activations. Then from there, we start to get that traffic, right? So the airways start to narrow, making it harder for air to flow to and from within the lungs. And as a result, that immune response leads to those signs and symptoms that we had talked about, the coughing, the chest tightness, and on the more severe end, perhaps an asthma attack or even a hospitalization, which we're working to avoid. So this really just pulls it all together in terms of what we were speaking about. If you're a reader and perhaps less of a visual learner, this slide really just emphasizes what we just talked about, that different triggers will turn on certain immune cells. Those immune cells can lead to different types of immune responses. And as we had talked about, certain blood tests can actually help assess the type and level of immune response. So your doctor's review of the results will really help you to determine potential treatment options that are best suited for you. All right. And then finally, before we round out managing the role that you play in your asthma care, we'll just take one more peek at the chat before jumping into this final section here. And let's see.
Good.
Good. Okay.
Mm-hmm.
We'll keep an eye on the chat just in case any questions come up before the end too. So this is my favorite part, the management and really the empowerment part for yourself as the patient or perhaps as the caregiver. So we previously alluded to an asthma action plan. So what is that? And really the asthma action plan is made up of 3 different parts that outline ways to both reduce and treat those asthma exacerbations that you may experience, manage your asthma symptoms, and then also gain control of your asthma. So this is a dialogue between yourself and your provider where both individuals are invested in one's control. So the 3 different parts of this include medications, the asthma journal, and lifestyle changes, and we'll talk about these each momentarily. But important to note that if you are experiencing an asthma attack, you should seek care immediately and inform your provider as well. And it is important to refer to the action plan regularly and bring to your medical appointments so that as needed, this resource can be updated. So the asthma journal, and we actually have a resource for you relating to this. So we'll screen share that momentarily, but we don't want to overcomplicate it. An asthma journal is just like a journal. It's something that you can use to chart your level of care and track different aspects of asthma that include things like peak flow. Peak flow is essentially a way to do at-home lung function testing. So while spirometry is more in the clinical setting, peak flow allows you to assess your lung function at home. We can track symptoms in the asthma journal, exposure to irritants and triggers that we had talked about previously, which again can be challenging to hone in on. So this is one way to hopefully better isolate those triggers. Your rescue inhaler use, any disruptions to daily activities. So perhaps you used to be able to walk and can routinely walk 2 miles, but over the past couple of days, you can only walk a mile just because of the impact that the level of asthma control has in your activity, and then sleeping as well. So what are some lifestyle changes that you can make both holistically and then even around your house to impact your asthma care? Simple things like vacuuming carpets that really can be a reservoir for different allergens and triggers around your home. Also washing sheets, blankets, using allergy covers on the bed to really help minimize that exposure to allergens when you're really lying in the same spot for 6 to 8 hours a night, potentially lowering humidity, limiting pets to the bedroom if these serve as like a key trigger for you, sealing doors and windows, and this will help limit the outside pollen and other irritants and perhaps smoke from getting in, and then also eliminating pests such as insects and rodents. And then healthy choices that are asthma and beyond. Maintaining a healthy weight can be impactful. As it relates to asthma, it's less mechanical obstruction on your chest, eating heart-healthy foods, exercising regularly as tolerated, minimizing or quitting smoking if you're a current smoker, and then healthy sleep habits as well. And then finally, medications. We won't spend a lot of time on this because we did cover this previously, and we won't dive into specific medication. But again, do want to call out that all treatment plans for a patient are unique. And this diagram is not meant to be included in patient-specific medication treatment plans. But again, the different medications that you may see and or may be taking include things like a short-acting or a rescue medication for as-needed use to manage your asthma exacerbations as the symptoms start to develop. Long-acting controllers, which are meant for daily use. And more times than not, these are inhaled medications. We talked about allergy medications. So for patients that have allergic asthma, they may be a candidate for certain allergy medications to help better achieve control. Then finally, we've got biologic medications, which are targeted therapies. And then rounding it out, we've got oral steroids, which can be used for additional asthma control when needed. So just to kind of summarize what we've talked about today, we've recognized and appreciated that asthma is a very common problem. Again, 25 million Americans with asthma overall, and still over 1 million individuals have that severe uncontrolled asthma, which we talked about toward the beginning of the presentation. We've discussed the role that the immune system plays as it relates to asthma, and that the asthma triggers and irritants and symptoms can in fact vary over time. And then finally, the role that you can play as it relates to improving your care or perhaps the care for a loved one with that asthma action plan and that dialogue and discussion with the provider. So with that, I want to call out a couple of resources here. American Lung Association, Allergy and Asthma Network, as well as our luma-edu website. I'll screen share that asthma journal with you momentarily. And again, this is a resource that Angela has access to that has these resources as well as a bunch of other resources at the end. So hang tight on that. And then finally, we'll just round out with a few quick closing questions that we had seen at the beginning that Arinze presented. So first question is, how is asthma severity determined? A, by symptom severity, B, by the frequency of asthma attacks, C, by the type and amount of medicines needed to control asthma, or D, by the type of triggers that cause asthma symptoms. So if you want to put your answers in the chat, and we'll go ahead and give you the final answer on this one. And I do see a couple questions in the chat too, so we'll get to those as well. All right, so I see all the above. Looks like a few other ones coming through. So this one actually is, again, severity is determined by the amount of medications needed to control asthma symptoms. So when we talk about severity, this relates to patients that need that high dose inhaled corticosteroid and then the other controller medication, the LABA. So C would be the correct answer. Second question, true or false? The immune system can be the underlying cause of a person's asthma. A, true, or B, false? Great. So true. So we talked about the role that the immune system can play and how, it's very dynamic. There's not one set pathway that leads to asthma. So there's a lot of different key players in the immune system leading to inflammation and then ultimately the symptoms that patients may experience. And then finally, this is kind of pulling it all together, the synthesis question, if you will. But patients with severe asthma are recommended to A, see an asthma specialist, B, work with their provider to create a written asthma action plan, C, track their asthma through an asthma journal, or D, all the above. Great. So correct. So the answer is D, all the above. Thanks for the participation. So when we talk about patients specifically with severe asthma, while these recommendations are great for patients with mild or moderate, specifically for severe asthma, recommended to see a specialist like a pulmonologist or allergist, working with the provider in that asthma action plan, and then finally tracking through that asthma journal, which I'll share in just a second. So last question, how would you rate this program? A being 4, which is great, all the way down to D1, which is poor. Awesome. Well, we want to leave some time for additional Q&A, so appreciate everybody's participation, dropping answers in the chat as well. And thank you, Rinze, for co-supporting. This was fantastic. I'll leave this QR code up here for a moment as we address the questions in the chat. Then we'll screen share that asthma journal with you that, again, Angela has and is shareable. If you'd like to access it, just connect with her. So let's see. So questions in the chat. Air purifiers or dehumidifiers. You have reasonable options, air purifiers potentially to help pull out smoke or other things that may kind of be hovering in the air that we might not necessarily be able to see. Reasonable option there to help with your level of control.
Matthew, can I jump in here? And I want to first thank you, you and Arenze, for your awesome presentations. And can I just build on that question, considering many of us love to sleep with our windows open, spring is coming all across the nation here, and we just got out of COVID and the guidance was keep your window open for fresh air. Those of us who might live with asthma or realize asthma, how do we keep our windows open and not have an asthma related trigger?
Yeah, appreciate that comment. And let me apologize if you hear some background motor rumblings. The people are mowing the lawn right now, so they're right outside my window. But as far as the windows go, fresh air, very reasonable. I would say if pollen is an identifiable trigger for you, you're going to want to be mindful of the pollen counts day to day, which, if you have a smartphone or access to the internet, something that's easily searchable in terms of the pollen count, the allergy index. And if it is a high pollen count day, probably best to close the windows and just either have the fans going and or central air or window unit if available to kind of maintain that level of coolness that's desired.
Okay.
Arinze, any other thoughts there?
Yeah, I was just gonna add in some anecdotal evidence. I also suffer from mild asthma, so it's not as severe as usual, but I've noticed that over the years, pollen has affected me a little bit more and more. I just recently bought an air purifier, actually. Sleeping near an air purifier, I do find helps a lot. I don't really suffer through the like dusty. I live out in California, but during the dusty, springy kind of season, I've seen my asthma symptoms go down. So that's one way that helps that situation.
Okay. So for those of us who may not have air purifiers, any guidance on just a traditional old fan, a oscillating fan? Do those stir up allergens and cause problems with asthma, or what's the guidance on fans?
Yeah, I would say, fans are reasonable. I mean, I think of myself just liking one for white noise, not even so much for the coolness effect, but just being mindful that, to your point, if the fan is blowing directly at you, and perhaps it's been a little while since you've cleaned your bedroom in terms of like the carpets or even in like hard surfaces, that you can be potentially, funneling a lot of allergens directly at you. So just being mindful of the surfaces in the room and trying to work toward making sure those are cleaned up so we're not blowing the allergens directly at you. And by extension, I'd say it's a good call to action as well, that if you live in a home, to make sure you're changing your air filter as well periodically.
And
Okay.
just to add on to also clean the fans. Fans are kind of one of those things that people don't clean often. So cleaning the fan so you're not just directly blowing dust and allergens at you.
Okay. And then for both of you, Matthew, you spoke to vacuuming. Now, how important is it to have a vacuum cleaner that has a HEPA filter, excuse me. And
Yeah,
what
so
is a HEPA filter for those of us who may not know?
The A always escapes me, but it's the high efficiency particulate. I'm blanking on it, but essentially, HEPA filters are very fine screens that essentially, when we're vacuuming or perhaps have some other filtration system, really work toward capturing as much that's circulating in the air, or perhaps like we're trying to vacuum up and maintain in the vacuum and not be recirculated in the surrounding environment. So the vacuuming piece, especially if there's carpets, but also if you have like hardwood linoleum, is important, again, to capture all of those allergens or other triggers that might kind of be lingering around, that can be lead to symptoms for you.
Okay. And Renze, did you want to add something there?
No, that's perfect right there.
Okay. Okay. Thank you. Okay. So I'm going to pivot just a little bit, and I want to ask you both about vaping and marijuana smoke. Any guidance for those of us who may live with asthma, and those of us who don't live with asthma? Any guidance with those two, marijuana and vaping?
Yeah, I'll say, the marijuana one we'll tackle first. So, I'm not tone deaf. I want to acknowledge that some people benefit from the active ingredients in marijuana, right? Whether it's for underlying medical diagnoses or perhaps recreationally, they enjoy it. And with how frequently we're seeing dispensaries pop up, marijuana in and of itself is very accessible for a lot of individuals. So a couple of things. One, definitely something you want to inform your provider about as far as marijuana use. However, it is being used like recreationally, medically. But one consideration is that the smoking marijuana can actually serve as a trigger, because it can irritate the lungs, lead to mucus production, et cetera. So definitely different formulations and ways of achieving therapeutic effects with marijuana. Probably out of all of them, smoking is less desirable. There's edibles, there's tinctures out there that patients may benefit from, but definitely a conversation to have with your provider. Vaping, similar to marijuana, it can, besides all the unknowns in vaping products, it can serve as an irritant, lead to cough, symptoms for a patient, mucus production, which can really add insult to injury and derail your efforts toward asthma control. So vaping in and of itself, not desirable. And then the marijuana piece, I think it's a little bit larger of a beast to consider in terms of what we're using it for and then how it's being consumed as well.
All right. Okay, thank you. And we've got 2 minutes, and I want to ask this question. Renze, you spoke to research studies. Can you give us some guidance of how someone might get involved in a research study? And if we have time, what that might look like participating in a research study?
How we can get involved, you can, I mean, I don't have the resources available right now, but organizations just such as ours, we have programs such as the RISE program, actually, that was mentioned before, where we're trying to include diversity into these research studies. I kind of spoke on it before, but a lot of problems with asthma research, but just research in general, is that we don't have enough participation in populations such as ours. So getting involved in those research studies may just involve that conversation with your healthcare provider, or looking out for these programs such as RISE to kind of include yourself into these research studies.
Okay.
Mm-hmm.
Perfect segue. We're at 2 o'clock, and we want to encourage everybody to talk with their provider about getting involved with asthma research studies. The more we know, the better and we can live. So again, I want to thank Matthew and Arinze for joining us. This is always a fruitful conversation. Matthew, just so you know, I've tried my hand at pickleball. I am not good at it, but I will continue to try. You inspire me always. Thank you both for joining us, and we look forward to seeing you soon.
Mm-hmm.
Thank you.
Thank you guys for having us.
Okay.
Do you mind if I just screen share the asthma journal?
Sure,
Briefly?
please.
Okay?
Thank you.
Perfect. Let's see. So just briefly, I'll keep it super quick, but we did allude to this asthma journal and the importance of it and kind of your asthma action plan. So this is one resource, if interested, that Angela has access to, and it's shareable. So just touch base with her. Wealth of information as far as some of the information that we covered, and then also different ways you can track your asthma journey. And then finally, again, in the spirit of richness, at the very end, there are a lot of asthma resources available to you to help yourself or perhaps loved ones with asthma as well. So just wanted to call that out.
Thank you, Matthew. And we'll get that out in our newsletter to ensure everyone gets that. Thank you very much.
Thank you all. Appreciate the partnership too.
Thank you.
Thank you guys.
Have a good day, everyone. Thank you.